Hi guys, my name is Maddie Furman. I'm a senior and today I'm going to be talking to you guys about how does a navicular stress fracture affect an athlete. So let's get into it. Okay. So of course we're going to first and foremost talk about patient information. This is going to just be the basic demographic of my case study and who this person is and what they're all about. So Rose Reed is the name my athlete chose to go under. She chose that herself. She was very proud of that. She's 24 years old. She's a basketball player. She's a female, and she is 75 inches, 6'3", which is pretty big for a female here in the US. This particular patient is actually a international patient, so that's very interesting to work with somebody like that. And she really had a different take on her day-to-day process and also how she wanted to handle her healing stage, her healing process and her recovery, basically. So let's get into all this great stuff. So patient history is very, very important. We always want to get patient history just to see if there's something we may have missed or if this patient by any chance has had an injury in the area we're looking at. So patient history, mechanism of injury is MOI. Mechanism of injury for this athlete, Rose, was lifting at summer camps. So about June, July is the time this would have happened. She had noticed that she started having a pain in her foot. It just slowly started to progress and progress. And she thought she could get through it. She thought she could just work through it and it'd be fine. And then, of course, the week kind of got along. It was starting to become a shooting pain, and she couldn't keep lifting on it, basically. And this is her left foot, of course. So she knew it just wasn't working out. So has the patient ever had an injury in this foot? This is kind of what we need to ask to find out. Is there an injury that we're missing? Is there something that we could know just based off of past information? So Rose has actually had a navicular stress fracture in the left foot when she was 15 years old. So automatically we could possibly add that in to see if that's possibly what this injury is. And I'll kind of walk y'all through how our athletic trainer went through her process and what she thought originally. But before we get to that, I'd like to kind of explain what this injury is and how it occurs. So what is a navicular stress fracture? So basically there's a bone. It's located in the medial aspect of the foot, right next to your cuboid bone. So kind of think when you're looking at your foot, if you're looking down, you're going to see your foot, and then it's going to be the larger bone towards the medial side of the body, very close to your ankle bones. So it's one of the 7 bones that make up the tarsus of the foot and ankle. It's a pretty large bone, so it's kind of hard to miss. And then, of course, how does a navicular stress fracture occur? Usually, this will occur due to overuse or direct blow to the foot. In this case, for Rose, it was going to be more of, like I said before, weightlifting, a lot of summer training, and just overworking that body. And then more than likely, it's going to be overuse of that bone itself. So that's kind of where we went for her. Now, this is kind of what a navicular stress fracture looked like. These are not Rose's scans. Unfortunately, hers were a little too blurry to look good on a screen like this, so you'll bear with me. So you basically are going to see where this arrow is pointing. That is the navicular. So like I said, the medial aspect of the foot, and you're going to see this small tear. Now Rose's fracture is a bit more midline than this one is. This one's pretty much on the side. So, but with this, I just wanted to kind of show y'all what we're looking at and what this would look like with the fracture itself. So moving on past that, our athletic trainer's thoughts. So getting into this and everything, in the beginning, our AT did all the special testing we needed to do for her. We believed originally it could be anterior tibialis sprain, basically because of overwork. So we knew overwork was a big factor in this, but we didn't know exactly what part of the overwork it could be. So she did anterior tibialis sprain, and then from there she did soft tissue massages and then a reverse Achilles tape job just to see if that would help. Time went on, about a week passed at this point with us doing soft tissue, reverse Achilles tape job, it wasn't getting better. Rose complained, it was still hurting, nothing was kind of helping it. So we decided to go in and send her for an MRI and X-ray. Now, with this question I have on here says, was the treatment the right course of action? For what we believed it to be, yes, this would be the correct course of action for an anterior tibialis sprain. But due to the fact we hadn't had an MRI or X-ray, our head AT wanted to pretty much get that out of the way. So went in for the X-ray into Dr. Crawford's office. He is the local orthopedic surgeon here in Lubbock. Rose saw him, went in for X-ray. X-ray was negative. There were no signs of a fracture of any sort, and the MRI basically confirmed that. So, we stuck with this original theory. It was a sprain. Time progressed, not getting better. We sent her in again for a second time. Second time she went to go see Dr. Crawford. We did another X-ray. X-ray showed the fracture itself. Now, a lot of times you're kind of wondering, like, how is that possible to see it the second time, not the first time? So these fractures are harder to see just because they do take time to really form and to be noticeable, because the foot bones are technically smaller than most bones in the body, and they're going to have a harder time of showing like a tiny hairline fracture when you think about it. So obviously not the right course of action for this one. When we did the X-ray, obviously we saw the fracture, and the MRI was kind of inconclusive based on the doctor's notes. So basically we're 2 weeks into her complaining, so 2 weeks in, this is kind of where we're at, our mindset. So then we have to go to a specialist here in Dallas, Texas. So next steps. So Dr. Curry is a foot specialist and orthopedic surgeon. He basically is working out of Dallas. So our head athletic trainer went with Rose down to see him to see what our best courses of action would be. He basically decided a very conservative treatment would just be to boot Rose for 6 to 9 weeks and see if there had been any healing in that area, just because we'll talk about this more later, of course, but having a surgery would take a little bit longer for this injury, and it's a bit more riskier, especially with an athlete. So we booted her, and I'm going to kind of walk you guys through what we did during that booting phase. So first, we did 1 week with non-weight bearing in the boot. So when we did that, we focused mostly on the quads, hamstrings, and glute strength. So really and truly, we were just wanting to strengthen up those muscles for when we did get her back and out of the boot and walking. That way she wasn't uneven on either side, and that way she was still able to walk with her gait as best as possible. Once we went past that way, we went to 1 week with partial weight bearing, boot with crutches. So basically what we wanted to do at this point was limited weight bearing rehabs. So we'd like to put her on the shuttle. We'd like to do pull exercises where she's a little bit weight's a little less off that foot, but we're still getting that movement in, still getting her, her gait normal, and still like helping her feel like we're slowly progressing towards something. We also did a lot of TheraBand exercises. So mostly focusing on 4-way bands, and then also kind of mixing some marbles in there too. Just to get movement in there, we need to get the blood flow pumping in there to kind of help with the fracture itself. More blood, more healing, fracture gets healed, of course. Past that point, 15 weeks until we were fully weight bearing. That was just to be a safety precaution. So until 15 weeks, we refrained from running and jumping, but we did try and do full weight bearing on the foot at this point in time. So we do all these steps. All of this rehab has been done. We're about, I want to say we're probably in about September, if not mid-September. We go in to see Dr. Curry again, see if we had any healing. Unfortunately, the injury is not healing. With a navicular fracture, this is very common just because there's very little blood flow to that area. As you can see in this little diagram here, I kind of have a diagram of how and where the blood supply is. And as you can tell, I mean, the blood supply is limited in the feet. It's very, very hard to get much blood supply down there, which is kind of why our feet are always cold in the winter, or at least for me they are. So we had to talk to Rose and ask her what she wanted to do, surgery or just to kind of work our way through it day by day. She chose to opt out of surgery because this is her senior year and she wants to play. So what we ended up having to kind of talk to her through was just kind of our day-to-day. If we don't do the surgery, it's not going to be fixed. automatically. So it's really going to just be if we can get enough blood flow there, then it could possibly start to heal. So that's kind of a give and take. There's not really a time period for that. Usually, I mean, healing on its own, she is young. She is an athlete though, and especially during end season, I mean, working on it and doing all these things is not going to help her. But we wanted to make sure she was able to have that senior year that she wanted. Okay, so like I said, after 25 weeks, we had an X-ray again. There was no improvement. Like I said, Rose opted for no surgery. So we're thinking no surgery. So like I said before, day by day is how we're taking this. We're just trying to get it to the point to where we can help her to the best of our abilities and still help her to play and live out her senior year, but minimal pain if possible. Because with the surgery, we would have put screws in her foot, and then she would have been non-weight bearing for a much longer time. So with that being said, we kind of just have to do rehab with her. What we're mostly focusing on, like I said, is strengthening calves and hamstrings. We really wanted to focus on getting a lot of movement into that foot if we could. Like I said, more blood flow. Doing the ankle mobility is helping with that. Band exercises are varied. We'll usually do either some stretches on the floor with her with the band, or we'll do some 4-way with her. Kneeling calf raises is something we usually do with her. She doesn't like them because it does put pressure on that foot, but we just do them anyway. And then of course we like to do eccentric calf raises, also kind of helping. She doesn't like those either because they're putting pressure on that foot again. So basically with all of this, we also wanted to work on endurance training for her because she is going to be playing. So we wanted to make sure that if she is in a game, she'll understand what the pain is. If the pain is too much, we'll pull her and go from there. So long-term treatment is where we're at. Basically, this is our day-to-day. We are in season right now. We are practicing. We do have games going on, and she is playing. Very limited play time for her, of course. We don't want to make that injury any worse than it already is. So what we're doing is basically we're doing just treatment for pain and range of motion. We're still continuing the rehab process of it itself, but really and truly at this point in time, it's just keep the pain as minimal as possible while she's playing and while she's recovering. So she really likes the BioWave for stimulation. She enjoys the way it feels and how it's helping through everything. She also likes the Thermix. Thermix we're really using for contrast, hot and cold, before and after practice, mostly before practice for the contrast, and then she'll do a little bit of icing or cold tub after to help with swelling. We're really just trying to get, like I said, blood flow to that area. We're really just trying to see if we can help heal that navicular fracture naturally. Like I said before, playtime is limited for her. We're not trying to not let her play, but we definitely want to be careful with how much we let her play, and just to see what our next transition to that aspect would be. So yeah, that's basically our day-to-day right now and how we're working with everything. I hope you guys enjoyed this presentation. I had a great time giving it. So if you have any questions, please put down in the comments and I'll be happy to answer them. Thanks guys. Have a great one.